Hello. So this project is a joint research between Victoria University of Wellington and the University of Otago, both of which are in New Zealand. Different departments, I should point out, so School of Engineering and Computer Science for Victoria University of Wellington, and then Department of Radiation Therapy for Otago. So let's talk about cancer. So according to data from 2016, cancer was responsible for 70% of all deaths annually and caused almost 10 million deaths per year. And 2 out of 5 people will have cancer at some point in their lives. So one way of dealing with cancer is through this thing called radiation therapy, which is a focus of our paper. And it involves delivering radiation to cancerous cells using medical linear particle accelerators, or LINACs for short. And there's one just there. So these machines require highly skilled operators. And one of the most common causes of errors during procedures is in fact misalignment or wrong levels of radiation. And that's something that can be fixed through training. But this equipment is in extremely high demand. For example, in the UK, a study found that the average wait time for treatment was 51 days, going up to a total of 379 days in the extreme. And in addition, the equipment is extremely expensive, so between several million US dollars up front, and then $500,000 US dollars every year after that. So these are all problems that limit access for training, which is a crucial part of becoming a radiation therapist. You need to have observational placements and then practical placements before you can qualify. So simulations in health. In general, these provide training without expensive and in-demand equipment. Immersion provides more transportable and practical skills and has been shown to be effective for many areas of health, including keyhole surgery, for example, knee surgery, where the surgeon has to use tiny tools that they can't even see because it goes through a tiny little hole in somebody. There's also X-ray imaging, which studies have shown that simulations of that can increase confidence and better understanding of where to stand. And there's also been clinical simulations, which have improved users' clinical and technical skills. But there is a lack of training simulations available for radiation therapy. There is one called VERT. So this is a semi-immersive simulation, which involves a large projector room that displays images on a wall display, and then the simulation follows a single user via special glasses, which you can see in the picture there. And this is in use at Otago University at the moment, and elsewhere. So this is generally considered effective compared to non-interactive media, and it increases the perceived conceptual understanding of procedures, but it does have some limitations. First of which is that it can't simulate physical interactions with patients, which is a key part of radiation therapy. Another is that it supports only a single user, whereas radiation therapy is always done with 2 technicians in the room. And it also costs around $700,000 US dollars. So this brings us to our software, which is called LINACVR, which is fully immersive and allows users to control the simulated environment via menus, which means moving the patient's bed, moving the LINAC machine, toggling lasers and markers which are used to help position the patient. Also allows you to load in models, as in the torso you saw, we'll see soon, and change model transparency, which we'll see in video just a second. So the models are loaded using DICOM files, which is a standard medical format, which is used by other things such as MRIs. And users can manipulate patient positioning physically using handheld controllers. So, onto the video. So you can see that the demonstrator has just moved towards the couch. And now he's going to be moving the patient around using these handheld controllers. If he uses 2, then he can rotate the patient's torso. And there's also menus that allow you to do various things, as I said before. So here he's turned on the lasers, which are used to help position the patient into the correct spot. And now he is repositioning the bed, again for positioning. And then lastly, changing the transparency of the patient's section, so you can see inside. The purplish sort of circle thing, sphere I guess, is the tumour for this case. And finally we see that the radiation is being delivered probably to the right spot. Okay, so another thing that our software allows is for multiple users. So this allows for radiation treatment to be performed by multiple therapists working together. And with multi-user simulation, students can practice working collaboratively before they try the real thing. It also allows educators to demonstrate techniques and procedures for supervised training. So here's a video of a multi-user scenario. As you can see, the second user has an avatar of sorts, which shows their field of view and their hands, or controllers, I should say. And they'll be going through some of the operations that were shown in the single user video, except this time, whenever one of the users performs an action, the other user will also see those changes. So they both always see the same thing, not accounting for lag. So again, they're moving the patient into position for treatment, using the menu controls, and then changing transparency again. And ultimately delivering the radiation to the patient's torso. Okay, so in addition to that, we also have a patient perspective, which allows you to sit on the patient couch within the simulation and observe the process, much like doing the real thing. Now, the reason we implemented this was because studies have shown that radiation therapy treatment often causes severe psychosocial stress, and patient education prior to the process correlates to lower stress. And this also allows for multi-user simulation also allows for customized experiences, which can be changed depending on the needs of a particular patient. So the architecture. Our project was developed in Unity 3D using C#, and it supports HTC Vive and Oculus Go. So the HTC Vive allows users to walk around in the simulation as well as teleport, whereas Oculus Go is a portable version, so it doesn't allow you to use motion capture, but you can still teleport. And then the multi-user simulation is achieved through Unity's multiplayer high-level API. And this is a peer-to-peer service. It doesn't require any technical knowledge. All you have to do is join or host a session. It's designed to be easy to use for anybody. So evaluation. We conducted a user study with 11 students and 4 educators from Otago University. It was aimed at evaluating multi-user and patient perspective features, and also looking at results of the simulation quality in general. So the process involved one-on-one sessions between single participants and the experimenter, which lasted about 60 minutes each. And during the session, participants were asked to perform a series of tasks within the simulation, which was navigating to equipment, manually adjusting the bed, turning on lasers, moving the bed with menus, lining up patient with markers, using transparency controls, and then finally, as you've seen before, initiating radiation delivery. Then after that, data collection was done through a pre- and post-study questionnaires and observational notes. So the pre-study questionnaire was background questions such as had they used VR before, what was their age and height, things like that. And then post questionnaire was all about the software. So moving on to some results. Here we have some quantitative data. The questions used Likert scale, and this is from the post-session questionnaire. So these questions relate to how effective aspects of the simulation were, including controls and menus, collaborative aspects, and realism. And they range from green, very effective, to red, very ineffective. So looking at these results, we can see that the median rating for every question was effective, and no question had less than 2/3 of its ratings as positive. But 3 or 4 educators rated the system as being slightly less effective compared to students, which might imply that educators have higher standards, perhaps because they have more experience with radiation therapy, but more testing is needed for that. So we also have some qualitative results. This is just a small sample of all that we've recovered, but I'll go through these. So the first question is, what differences did you notice between this simulation and the real-world Linux environment? And there was lack of sound made a difference, as often Linux can be relatively loud. Additional equipment in the room's background was missing, and hand controls are different to Linux pendants. The other question was, how did this application compare to any other Linux simulation programs you've used? And VERT includes real Linux pendants, which is an important component for training, which we don't have. But it does fill many of the gaps in experience offered by VERT, and the ability to interact with patients is fabulous. And it's also nice to have collaborative work that makes it a bit closer to an authentic experience, another participant added. So discussion. So one of the things about VR is that it can be a novel experience for those who have not used it before, and we wanted to make sure that we took that into account. in our results. So we found that when we did a comparison between participants with VR experience and those without, it showed that there probably wasn't a VR novelty bias. But there was a limitation, which was mentioned just on the previous slide, that using a real-life treatment couch pendant would be a lot better than using the VR controller. That's something we might look into in the future. So overall, the results show that 11 of 15 participants considered the solution to be effective or very effective for training radiation therapists. And then of the remaining 4, only 1 considered to be ineffective. It was also effective for collaboration and patient experience, and has distinct advantages of VERT, including interactivity, immersion, and collaboration. So just to summarize that, so our software LINACVR is the first collaborative VR tool for radiation therapy, which provides immersive simulation for training and patient education. And a user study showed our tool is effective for training and very effective compared to existing alternatives. And the patient perspective provides effective representation of patient experience.